Nearly every trip to the hospital involves putting your life in the hands of trained professionals.
But even those trained medical professionals need to keep their skills fresh. In today's Health Check, Delane Cleveland shows us how Hennepin County Medical Center is ensuring that its employees are prepared for every scenario.
Situated on the lower level of HCMC sits a room that, at first glance, looks just like a normal operating room. But take a closer look at what's strapped down on the beds, and you'll see that this room has some unique features.
This room is designed to be our high-fidelity simulation room to replicate either an operating room or the trauma area of the emergency department.
Gene Streck runs this brand new simulation room, which opened January 7th. It will be used primarily by HCMC's nurses and physicians.
That's basically the whole idea, is to gain new skills, sharpen skills that are existing, and polish up on skills that, it's a procedure you just don't do a lot of.
Human patient simulators in the form of high-tech mannequins are one of the most important tools these healthcare professionals will use for their training.
He blinks, his eyes react, he can sweat, he can cry, he can seize, he can have foam coming out of his mouth, he can have blood coming out of his ears.
The mannequins can also talk.
Oh, I can't breathe and my chest hurts.
That's just a small sampling of what Streck can make them do from his control room overlooking the simulation center.
So they're getting the actions of working with a real person.
However, there's a few things the mannequins can't do.
He won't poop, he won't vomit, thank God.
Prior to construction of the simulation center, Streck says training would occur in classroom settings or at outside locations.
It brings physicians, nurses, EMTs, paramedics, healthcare providers into the actual moment that they would be in, as opposed to sitting in a classroom per se and just having a discussion.
He says working on these lifelike mannequins will give healthcare professionals the skills they need to work on the real people.
That eventually will save lives and prevent medical errors.
In Minneapolis, Delane Cleveland, 12 News.
HCMC's education programs are expected to train more than 20,000 caregivers each year.